Hi, everyone. My name is Tiffany Musig. Thank you for having me. I'm a senior public health specialist at the Missouri Department of Health and Senior Services, and my primary responsibility is to coordinate the statewide efforts for community health workers. We are going to talk about several different things today. In our time together, as you can see on screen, we will be talking about all aspects of community health workers, or as you may hear me refer to them as CHWs. We'll start with a definition of a community health worker, their roles and responsibilities, the CHW training in Missouri, the CHW Association of Missouri, credentialing for CHWs, and we'll end with several examples of how Missouri CHWs are making a difference. Let's first take a look at the definition for the position of the community health worker. The Missouri Department of Health and Senior Services has chosen to use the American Public Health Association's definition of community health workers, or CHWs. This definition says that CHWs are frontline public health workers who are trusted members of and/or have a close understanding of the community served. This trusting relationship enables the CHW to serve as a liaison between health and social services and the community to facilitate access to services and improve the quality and cultural competence of service delivery. A CHW also builds individual and community capacity by increasing health knowledge and self-sufficiency through a range of activities such as outreach, community education, informal counseling, social support, and advocacy. The Center for Disease Control and Prevention has a similar definition that states that community health workers are liaisons with resources in the communities they serve. CHWs play a vital role in improving Missourians' health by providing a connection between health systems and community resources, as well as education on how to reduce behavioral risk factors. Community health worker is an umbrella term and includes titles such as community health representatives, promotores, peers, and other workforce members who are frontline public health professionals that share life experiences, trust, compassion, culture, and value alignment with the communities where they live and serve. I've listed a few of the many titles that fall under the community health worker umbrella, such as patient navigator, community health representative, promotores, public health aide, community outreach worker, peer support specialists, and lay health advisors. Those are just a few that fall under the umbrella. We're going to spend just a couple minutes watching this video, if I can get it to play, but that was created by the Kansas City CHW Coalition and the Mid-America Regional Council, and it really just emphasizes what a community health worker is.
Our health is influenced by many things.
Sorry about that.
Our health is influenced by many things, like healthy food, secure housing, or access to healthcare. Those without adequate housing or employment, or who struggle financially, often have worse health outcomes. Community health workers provide critical support to those in underserved communities.
Community health workers are a key part of the healthcare system or the healthcare team. They work with members at the one-to-one level, and what they do is support them by assessing and addressing their social economic needs. One of the taglines for community health workers is they are of and from the community they serve. And that is so important.
Community healthcare workers are those frontline, boots on the ground folks who get in with the community and the people that they work.
Somebody who puts their heart and to put their passion just to make sure that others are getting what they need.
Community health workers are trained health professionals who help connect residents in underserved communities to resources. By helping clients obtain resources such as utility and rent assistance, healthy food, medications, transportation to medical appointments, their health status is often improved. Community health workers bridge language and cultural barriers to help clients communicate with care teams and follow through with their care plans.
Most of the time, community health workers have something very special, which is that they understand they have been in the community they serve. So they're able to relate with those that they're working with. What we have been advocating for is to bring that one-to-one level of care, to bring that connection between individuals and that trust that has been lost for many years.
And our goal is to really bridge those gaps where families are encountering barriers to accessing health services. So our community health worker spends a lot of time listening to the family first to understand what they need. And then from there, they begin to build, I think, a level of trust that allows them to help that family.
They are the ambassadors of health. You know, they just have a good understanding of the medical system, the social system, and also the clients in the community. So that's what to me a community health worker is.
Most community health workers are lay people in the community. We just are connectors. It's always good to have a peer, someone who's been there, who knows you, your community, your language, so to speak, whether it's literal language or, figuratively, where we're from.
Both Kansas and Missouri have established CHW certification programs. And in the Kansas City area, more than 20 organizations work with CHWs to improve the lives of their clients. CHWs work across the whole system, from hospital emergency departments to community organizations that provide social supports.
Do you want all families of all children to be able to access healthcare services in a timely manner and in a way that prevents problems from happening? And if you can answer yes to that, then you really want more community health workers.
There is a lot of evidence, research, and at the local level and at a national level, at a global level, that the role of community health workers is very important. They can have great impact on health outcomes because they are taking care of those socioeconomic factors or addressing those socioeconomic factors that clinical providers or the clinical team are not able to address on a clinical setting.
Community health workers can often get to some of the root causes of our illnesses that are, beyond the surface. Because we build those trusted relationships, we can find out a little bit more about what's going on at home.
When a client is struggling with their needs, sometimes they are overwhelmed. They feel like they fell through the cracks through the system and no one is helping. So when a community health worker is working with clients, they just get together in the client's house, right? So you are safe, you're in your own spot, you're in your own place. And it is that relatability that makes the client feel comfortable and they open up.
Community health workers are very much naturally, culturally competent. They are culturally humble. And they use those skills to advocate and protect the individuals that they work with. And also, I think it brings a lot of value for the provider. They are actually making sure that what the provider is saying, either in the same language or in another language, is being understood. So when the client or the patient leaves that office, the community health worker, the patient, and the physician are in the same page that is understood what is expected from the member.
At the end of the day, it's not just the CSW who has to do all these. The CSW is the person that can open or lead the client to the door, but the client is the one that needs to open that door and just making sure that they follow through with the plan and everything. So
Community health workers are in the right place at the right time in clients' homes and neighborhoods to help people self-manage their health conditions and improve their health outcomes. CHW's work complements and supports the work of physicians, nurses, and social workers.
The favorite part of my job is just connecting with people. Love to see the aha moments. Love to see, people's like, I did it. I'm doing this. Yes, you did. Yes, you can.
We are just making sure that all the clients are becoming more self-sufficient. So that is gonna help now and in the future, because if you train people on how to do those things on their own, that's magic. That is gonna make sure that people is not struggling in the future. We might struggle with resources, but they will know how to get there when the resources are there.
It's an emerging role and it's an exciting time to be talking about it because I think it may be new to you, but it will undoubtedly become a familiar term, I think, over the next 5 to 10 years for a lot of people. I hope so. If it was up to me, we would be inserting them everywhere, in schools, in clinics, in churches, not just in emergency rooms and acute care settings, but we really need our community health workers everywhere we are. So.
Community health workers bridge gaps in our healthcare systems, providing better health outcomes for our family, friends, and neighbors.
One of the things that I think we're very slowly shifting is to the understanding that we have been paying for to fix things that are already broken. And we have done very little as a healthcare system to work in prevention and management. So if we know that and we can intervene early on time, we will be saving millions of dollars to the healthcare system. And we can do that by investing on a workforce that can do a lot of that work. And we are not there yet, but I think we will be there soon. Yeah.
Now that we have defined community health workers, we will discuss social determinants of health, or SDOH, and how they relate to the role of CHW. It's important to understand what social determinants of health are so that we can understand why community health workers are so valuable. According to Healthy People 2030, social determinants of health, or SDOH, are the conditions in the environment where people are born, live, work, play, worship, and age that affect a wide range of health functioning and quality of life outcomes and risks. It is important to ensure that patients' social determinants of health are met first, because if they're not, their health outcomes will not matter to them. Social determinants of health can be grouped into 5 domains as shown on screen: economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and social and community contexts are the 5 domains. Social determinants of health can have a major impact on people's health, well-being, and quality of life. Examples of social determinants of health might include safe housing, transportation in neighborhoods, racism, discrimination and violence, education, job opportunities and income, access to nutritious foods and physical activity opportunities, polluted air and water, and language and literacy skills. Social determinants of health also contribute to wide health disparities and inequities. For example, people who do not have access to grocery stores with healthy food are going to be much less likely to have good nutrition. That raises their risk of health conditions such as heart disease, diabetes, and obesity, and even lowers life expectancy relative to people who do not have access to healthy foods. Through the shared understanding, respect, and mutual empowerment offered by CHWs, social determinants are addressed. CHWs are in place to extend beyond the clinic or hospital and into the real world. In order to ensure success and sustainable health recovery, CHWs must first help their clients overcome the social determinants of health that are barriers such as transportation, housing, or employment. Let's see if I can get this to play. We're going to watch just a real quick clip from Healthy People 2030 that just really emphasizes the importance of focusing on social determinants of health.
At HHS, we define the social determinants of health as the conditions in the environments where people are born, live, learn, work, play, worship, and age. Social determinants affect our health, well-being, and contribute to health disparities and inequities as well. Healthy People, our nation's longest-running disease prevention and health promotion initiative, emphasizes addressing the social determinants of health to create environments that promote health and well-being for all. I'm Admiral Rachel Levine, Assistant Secretary for Health at the United States Department of Health and Human Services. Healthy People 2030 provides a framework for thinking about the social determinants of health across 5 domains. Here are 5 social determinants of health. First, economic stability. People with steady employment are less likely to live in poverty and more likely to be healthy. By helping people earn steady incomes, we can achieve economic stability for all. Second, education access and quality. People with higher levels of education are more likely to be healthier and live longer. By helping students excel in school, we can improve educational access and quality. Third, healthcare access and quality. Many people in the United States are unable to get the healthcare services that they need. Increasing access to high quality healthcare services will ensure more individuals can attain their full potential for health and well-being. Fourth, neighborhood and built environment. Health and safety risks like high rates of violence and unsafe air or water impact health and quality of life. By creating safe communities, we can provide opportunities to promote playing and physical activity. And fifth, social and community context. Increasing relationships and interactions with family, friends, neighbors, and community members is beneficial to an individual's health and well-being. To learn more and see how others are working to address social determinants of health across the nation, please visit healthypeople.org.
Now that you have an understanding of how the role of a community health worker is defined and what social determinants of health are and how they could affect someone's overall health, let's take a look at the role of a community health workers. Community health workers truly have a wide variety of duties. They recognize gaps and advocate for individual and community health needs. They assist in coordinating care by linking people to appropriate information and services. CHWs also provide culturally appropriate health education to individuals, organizations, and communities in an effort to reduce modifiable risk factors and encourage healthy behaviors. They also serve as a culturally informed liaison between individuals and community healthcare systems. Perhaps most importantly, they provide encouragement and social support to assist individuals with goal settings and barrier identification while staying within their professional boundaries. CHWs assist clients in their homes, community, or clinical settings. They communicate to their clients the purpose of the program and the impact it may have on their well-being. They help patients identify socioeconomic issues that affect their overall health and develop health and social management plans and goals. CHWs coach their patients in effective management of their chronic health conditions and self-care. They assist their patients in understanding care plans and instructions. CHWs educate their clients on the proper use of the emergency room and provide information about alternative care sites. They motivate their patients to be active and engaged participants in their own health and overall well-being. They also document all client encounters. They complete and submit reports as required by their employers, maintain comprehensive electronic client files, including client notes, release of information, assessments, and other medical documents acquired on behalf of their clients. CHWs facilitate communication and coordinate services between providers and the patient. They coordinate and monitor services, including tracking of clients' compliance in relation to care plan objectives. CHWs also provide support and advocacy during initial medical visits or when necessary to assure clients' medical needs and referrals required are being conveyed. They also follow up with both clients and providers regarding health and social services plans. CHWs do not only work in the health field, they also can work in the social services field. The community health worker workforce is on the rise nationally. Many different types of agencies have discovered that community health workers are often the key to reaching people who are left out in traditional healthcare and services. Community health workers are employed in many different types of organizations, such as hospitals, medical clinics, outpatient care centers, schools, religious organizations, nonprofits, and even pharmacy. In Missouri, some of our partners have developed a few unique programs for CHWs. One being there are currently over 100 pharmacy technicians in Missouri that have been formally trained as CHWs. We will discuss this particular training program later, but it is important to note that this training is for pharmacy staff created by pharmacy staff. Missouri also has several doulas that are cross-trained to CHWs. These cross-training opportunities provide the clients with even better care. The reality is that CHWs anywhere have a similar role to link people with health and social services to improve the quality of care, but they work in so many different settings. They work wherever they live, including rural areas, urban areas, and major metropolitan hubs. Missouri has developed a comprehensive training for CHWs based around the CHW core competencies. Missouri CHWs are trained and expected to meet and understand the core competencies listed on the screen. These core competencies guide the training CHWs complete in Missouri and Kansas, but let's talk a little bit about what they mean. Professionalism and conduct includes how to handle ethical challenges facing the individuals and communities served, individual confidentiality and privacy rights, balancing care for patients and self-care, how to act decisively in complex situations, but also take full advantage of professional collaboration and supervisor support when needed. And finally, the importance of observing organizational rules and applicable laws and regulations governing public and private resources, while exercising creativity and helping community members meet their individual and family needs. Self-awareness seems pretty self-explanatory. However, it is really important. CHWs need to understand the importance of being aware of one's own emotional and behavioral responses to individuals and community members and manage personal feelings productively in order to maintain effectiveness. Coordination of care and system navigations for individuals and families means that CHWs assist the licensed healthcare providers in the coordination of care, help people understand and use the services of health providers and other service organizations, help address practical problems that may interfere with the ability to follow the provider's instructions and advice, helping to bridge cultural, linguistic, knowledge, and literacy differences, and understanding and sharing information about available resources and support to improve health services. Education for healthy behavior change means providing people with information, tools, and encouragement to help them improve their health and stay healthy over time, while also respecting people's experiences and their ability to learn, take advantage of resources, and set priorities for changing their own behavior. Advocacy is working with or on behalf of people to exercise their rights and gain access to resources. It also involves supporting individuals and the community by bringing awareness to issues impacting health. Individual and community capacity building go hand in hand with advocacy. It is encouraging individuals to identify and prioritize their personal, family, and community needs. It's also encouraging individuals to identify and use available resources to meet those needs and goals, and providing information and support for people to advocate for themselves over time and to participate in the provision of the improved services. It's also building and maintaining networks and collaborating with appropriate community partners and capacity building activities. Effective communication strategies include listening carefully and communicating respectfully in ways that are meaningful to the individual. It's a mix of listening, speaking, gathering and sharing information, resolving conflict, and checking for understanding. CHWs are meant to be cultural mediators by improving services and reducing disparities. Identity, as we know, is based on race, ethnicity, language, religion, sex, gender identity, sexual orientation, disability, health condition, education, income, place, profession, history, and other factors. Cultural also includes organizational cultures, which are reflected in how organizations deliver services. The CHWs encourage and help enable individuals to participate in decisions that affect their lives, their families, and their communities. Documentation and reporting is very important to the role of CHWs. CHWs help promote coordinated and effective services by documenting their work activities, which includes writing summaries for individual and community assessments accurately and presenting the information to organizational colleagues or community partners about the individuals and issues they face while respecting people's privacies. Public health and community health is an evidence-based discipline that focuses on protecting and promoting population health, preventing illness and injury, eliminating health inequalities, and working to improve the health of vulnerable communities and populations. CHWs understand that individual health is shaped by family, community, and social determinants of health. Individual assessment is an ongoing process that, when combined with regular evaluation of progress, helps assure effective individual and community-centered care. Individual assessment is the gathering of information from direct communication with individuals to understand, identify, and address the individual's goals for optimal health. CHWs facilitate health improvement planning with individuals and consult the healthcare team to agree upon a plan as appropriate. Community assessment is similar, but also it focuses solely on the community, and the purpose is to identify barriers and resources within that community. A community assessment is necessary for advocacy and capacity building to occur. Missouri has 3 versions of our curriculum that are state approved. All 3 are based on the textbook shown on screen, Foundations for Community Health Workers, 2nd edition. It's used for the CHW course at all curriculum providers in both Missouri and Kansas. As I said, we have 3 versions of this curriculum. The first version that was created was a chapter by chapter approach to this textbook, which is the traditional way of teaching any class. After some feedback from curriculum providers and students who had taken the course, a core competency-based approach to the text was created. Most recently, a pharmacy-specific version of the curriculum was created for pharmacy technicians being trained as community health workers. This version follows the core competency approach, but has specific examples related to the pharmacy setting for these individuals. These 3 versions of the state-approved curriculum are the only recognized curriculum for CHWs in the state of Missouri. CHWs are always welcome to take courses from other organizations, but they will not be eligible for credentialing in Missouri if they do, which we will talk about in just a moment. Training program certification is overseen by the Missouri Department of Health and Senior Services. At this time, the Bureau of Cancer and Chronic Disease Control maintains all aspects of the training program certification. This process has allowed the CHW curriculum to be accessible to as many CHWs as possible and help support the growth of the CHW workforce in Missouri. The department accepts applications from potential curriculum providers from May 1st through June 30th of each year. During the month of July, a committee of 3 people review the application. That committee is made up of myself, 1 other person from the department, and 1 board member from the CHW Association of Missouri. Each application is scored based on a rubric. Once all applications have been reviewed, a letter is then sent to each applicant informing them if their application has been approved or denied. If they are denied, the exact reasons for the denial, along with suggestions for improvement, are given, and the applicant is welcome to apply the next year. If the application is approved, the letter includes information about where to access the curriculum and resources, along with links to our pre- and post-course survey. Before teaching the CHW certificate course at a certified curriculum provider, trainers must complete the Train the Trainer course. Whether a trainer has been teaching college level classes for 30 years or has no training experience, they are required to complete this course through DHSS. We offer this course 2 to 3 times a year, depending on interest and need statewide. This course consists of 3 synchronous or in-person trainings, which are held via WebEx. There are also 5 asynchronous or pre-recorded trainings that are assigned throughout the course. Each participant ends the class by creating a 30-minute lesson that they will present to the course instructor and a group of their peers. This final presentation has to include a written lesson plan and include some of the adult learning strategies that were learned throughout the course. The presentation must also connect to at least one of the CHW core competencies. At this time, Missouri has 14 curriculum providers. The map on screen has stars where these providers are located. 2 of our curriculum providers are actually located in Kansas and both train CHWs in Missouri and Kansas, since Kansas has adopted the same curriculum for CHWs. Community Health Council of Wyandotte County is in Kansas City, Kansas, and then Wichita State University Community Engagement Institute, which partners with the Kansas CHW Coalition, offers their course online all throughout Kansas and Missouri. There's one other organization not shown on screen, and that is CE Impact. Their course is exclusively online, and it is the one I spoke about that is intended only for those that are currently pharmacy technicians training as community health workers. We have several colleges across the state offering the course, including Metropolitan Community College in Kansas City, State Fair Community College in Sedalia, Central Christian College of the Bible in Moberly, Mineral Area Community College in Potosi, Southeast Missouri State University in Cape Girardeau, St. Louis Community College in St. Louis, Three Rivers Community College in Poplar Bluff. We also have Diabetes Education Augmenting Lifestyle Center and Clinic in St. Louis that focuses on CHWs working with clients with diabetes. We have Real Justice Network in Kansas City that focuses on justice-involved individuals and single parents. And then we have Uzazi Village in Kansas City and Doula Foundation of Mid-America in Springfield that train doulas as perinatal CHWs. DHSS hosts a statewide advisory meeting quarterly, and during this meeting, we seek input from CHWs, their employers, and instructors. We also have an opportunity within this meeting for each region to share resources, updates, and best practices. These meetings have been very powerful for the CHWs, and there are often over 100 in attendance. At this time, St. Louis, Kansas City, Northeast, and Southwest have regional meetings where they have opportunity to network and share local resources. DHSS is currently working with the Southeast region to help them develop collaborative regional meetings, and will soon be working with Central and Northwest to do the same. CHWs in Missouri have an opportunity to become credentialed. The community, let's talk about their credentialing requirements. In order to become a credentialed CHW or CHWC, an individual must have the minimum of a high school diploma or equivalent. They must also have completed a CHW certificate program at one of the approved curriculum providers that we previously discussed. And each year DHSS will then send the Missouri Credentialing Board an updated list of approved curriculum providers. The application can be found, on the Missouri Credentialing Board website. It really is pretty straightforward. The information shown on screen is what is required. They have to complete the application, sign a code of ethics, complete some background checks, show proof that they've completed the CHW certificate course and that they have a high school diploma or equivalency, and then a $75 application fee. This, once approved, they are credentialed for 2 years, and then they have to complete a re-credentialing process at the 2-year mark. Once a CHW is credentialed, they're required to complete 20 hours of continuing education every 2 years. 6 of those hours have to be ethics. The CHWs are expected to keep track of their own CEUs, and they keep their certificates. And when it's time to re-credential, the CHW is required to send in proof of their CEUs. The Community Health Worker Code of Ethics includes information regarding responsibility in the delivery of care, promotion of equitable relationships, interaction with other service providers, and professional rights and responsibilities. That Code of Ethics is located on the Missouri Credentialing Board website if you are interested in taking a look. All right. The Community Health Worker Association of Missouri, or SHWAM as it is affectionately called, is a collective of people throughout the state of Missouri working to improve health outcomes for a diverse population. The association brings members from across the state together to share ideas, raise awareness, and support each other in the journey towards public health. Schwam has nearly tripled in size in the last year alone. The mission of Schwam is to unite the CHWs, CHW instructors, employers, payers, and other stakeholders for professional development and community outreach to serve the communities in which they are involved. The Community Health Worker Association of Missouri held their annual conference in March. They had great turnout and excellent speakers with over 250 in attendance. If anyone happens to be interested in speaking at the 2024 conference, please let me know and I can connect you with the association. Schwam's mission and vision is put into action through advocacy, educational opportunities, professional development, community resources, employment resources, and networking opportunities. Just wanted to introduce you to the Schwam board. It's made up of 13 professionals from all across Missouri. Suzanne Smith is the president of Schwam and is also the chief network development director for HCC Network. She's also the lead facilitator on the CHW Hub Echo team. We have Sierra Walker as the vice president of Schwam, and she also serves as the project coordinator with St. Louis Integrated Health Network's Community Health Worker Workforce Partnership. She's also the executive director of the St. Louis CHW Coalition. Hannah Oberg is the treasurer of Schwam. She's a credentialed CHW working as a housing specialist at Family Care Health Center in St. Louis. And then we have Florence Adegoke as the Schwam secretary. She's worked in public health for over 30 years. She currently works with the social determinants of health team at University Health Truman Medical Center in Kansas City. We have Ryan Smith. He is the St. Louis member at large. He's currently employed by St. Louis Integrated Health Network, connecting patients and justice-involved individuals to medical and social services resources as appropriate to assist with system navigation and work on strategy that creates access and improved utilization of care and services. He's also on the board of leaders at the St. Louis CHW Coalition. Melissa Smith is the Kansas City region member at large. She also works at HCC Network as the director of population health, overseeing CHW's peer recovery coaches and the transportation program. Kathy Mason is the Southwest region member at large. She works at Freeman Health. Lorna Miles is the Northeast region member at large. She works as a project director at Randolph County Caring Community Partnerships. Amy Summers is the Northwest region member at large. She's been an LPN for 31 years, a case manager for 15, and CHW for the last 5 years. Yvette Chambers is the Central Region member at large. She's currently working at MU ParentLink as a kinship navigator. Treva Smith is the National Association for Community Health Workers ambassador. Treva works as a care coordination supervisor at Kansas City Health Centers, and she's also on the board of the National Association of Community Health Workers. Finally, Atara Estes is the past president. She works at Integrated Health Network in St. Louis for the Relink program, helping justice-involved individuals connect to resources to ensure successful transition after incarceration. Community health workers make a difference in their clients' lives day in and day out. I hear so many stories about how a community health worker has changed the entire trajectory of someone's lives. One of the administrators from the Columbia Boone County Health Department said that CHWs breathed new life into their agencies. CHWs working in the community is shedding new light on what the health department does and needs to do. We really are helping people, she said. The Southeast region of the state has also had a great deal of success incorporating community health workers in a variety of settings. Excuse me. One agency in that part of the state was able to help a 74-year-old woman find housing in a nursing home. The CHW has continued to follow up with her to address chronic illness. The CHWs in that agency have also found housing for 5 additional people since December and are continuing to work with these people to address their health needs and social determinants of health. CHWs have also worked in a school-based dental clinic in an elementary school in the southeast part of the state. The dental clinic found a tumor in the roof of a student's mouth. Because of this early detection, the student had surgery to remove the tumor and is now doing great. The CHW continues to follow up with the student and family about other social determinants of health. Another CHW in the southeast region helped a homeless veteran suffering from PTSD find housing and get connected with the necessary medical providers. Because of the assistance the CHW provided, this veteran now wants to give back and help others in this situation and is looking into taking the CHW class himself. The St. Louis region also has some great things happening. They have CHWs working inside jails with incarcerated individuals that are getting ready to be released. Through the ReadLink program, the CHWs help their clients connect to resources so that they are set up for success upon release from jail. Missouri also has fantastic things happening in pharmacies. Missouri has the only curriculum designed to train current pharmacy technicians as community health workers in the nation. If you think about it, pharmacy technicians often have more contact with patients than their doctors or pharmacists. Patients with chronic illness typically see the pharmacy technician every single month for refills and may see the doctor every few months for a checkup. Unless it's a new medication, they don't always speak to the pharmacist. However, the pharmacy technician is able to develop a relationship with the patient, making it more likely that the patient will feel comfortable discussing other social determinants of health. The pharmacy technician is then able to connect the patient to resources, ensuring that all needs are met. There's a pharmacist in Southeast Missouri that tells about a patient that he encountered a few years ago, and it's one of the best examples of the benefits of having a community health worker on the care team. The local doctor had diagnosed and been treating an older woman for diabetes. Months go by and the patient is on insulin daily, but her A1C is simply not coming down. The doctor talks to the pharmacist and asks, is the client picking up the medication? Pharmacist says yes. Okay. So he asks the client, are you taking your medication? And she says yes. Are you taking it as prescribed? Absolutely, she said. The doctor and the pharmacist put their head together and determined that there's no way that the woman's A1C would continue to rise if she was eating properly, like she said, and taking her medication properly. The doctor then asked the client if it was okay if her assigned community health worker came to visit her in her home. The patient says, of course. The community health worker then goes for a home visit on a bright, beautiful fall day. After visiting a bit and going through the standard questions, she asks the patient, can you show me where you store your insulin? The patient agrees and shows her that it is in the refrigerator, just as the doctor and pharmacist have instructed her. Remember how I said it was a bright, beautiful fall day? Well, prior to looking in the refrigerator, the community health worker had not noticed that the lights were not on. She hadn't noticed that because the curtains were open and the windows were open, but as it turns out, there was no electricity in the home. The patient had been following the doctor's instruction verbatim, but not one person had asked if the refrigerator was working properly or if she had electricity in her home. It's not a common question that you would think to ask. The patient hadn't mentioned it because no one had asked. The community health worker was then able to connect this patient with utility assistance to get her electricity and water turned back on and make a plan to ensure that it stayed on moving forward. This patient now has her diabetes under control and her medication is working fantastically because it is properly stored in a working refrigerator. Before I take questions, I want to watch one last short clip together. This video shows Magdalena's story and how a community health worker changed her life. Magdalena is a patient at Lorna Linda University Health's Diabetes Treatment Center. She was depressed and immobile, having difficulty navigating the complex health system, but a community health worker was able to help. As we watch this video, think about what would have happened to Magdalena if she hadn't had a community health worker available to offer the support needed.
Community health worker is really the bridge between the healthcare system and the community. They're the eyes and ears of the healthcare system, looking at what the environment's like that we're sending patients back into.
Community health workers can spend more time with their patients, but more importantly, they come from the community. So they understand because they themselves have a similar shared lived experience, or they've had to overcome and build their own resiliency.
We've always lacked that ability to kind of go outside of these walls. We can't see what the patients are up against in their actual setting at home. So community health workers are able to leave the clinical setting and kind of go out into the community and bridge that gap.
Mi corazón está al 30% y traigo marcapasos. Loma Linda me mandó a las clases de diabetes y yo fui y ya la enfermera me dijo que llenara la aplicación. Yo le dije que no sabía y le hablaron a Alejandra y ella vino a ayudarme en los papeles. Sí, porque yo no puedo el inglés, ni sé escribir, ni leer, ni nada, entonces ella me ayudó en todo.
I explained to her part of my work, but I don't like to be like, this is what I do, boom, boom, boom. So it's more like a friendly conversation. So I told her like, I can do home visits if you want, we can just talk. And if something that I can help you with.
Sorry, I'm not sure what happened.
Community health worker is really the bridge between the healthcare system and the community. They're the eyes and ears of the healthcare system, looking at what the environment's like that we're sending patients back into.
Community health workers can spend more time with their patients, but more importantly, they come from the community. So they understand because they themselves have a similar shared lived experience, or they've had to overcome and build their own resiliency.
We've always lacked that ability to kind of go outside of these walls. We can't see what the patients are up against in their actual setting at home. So community health workers are able to leave the clinical setting and kind of go out into the community and bridge that gap.
Mi corazón está al 30% y traigo marcapasos. Loma Linda me mandó a las clases de diabetes y yo fui y ya la enfermera me dijo que llenara la aplicación. Yo dije que no sabía y le hablaron a Alejandra y ella vino a ayudarme en los papeles. Sí, porque yo no puedo el inglés, ni sé escribir, ni leer, ni nada, entonces ella me ayudó en todo.
I explained to her part of my work, but I don't like to be like, this is what I do, boom, boom, boom. So it's more like a friendly conversation. So I told her like, I can do home visits if you want, we can just talk. And if something that I can help you with, I'm more than happy to do it. But this is gonna be like together, like hand to hand.
Sí, ahora hay un cambio mejor de mente y de cuerpo. Ahora ya puedo caminar más. De mente me siento mejor, porque antes tenía como sentía mi muerte y pues sentía como mucho depresión. Y ahora ya siento que estoy mejor. Y antes tenía que andar aquí en mi casa con bastón. Y ahora camino sin bastón y ya camino, voy a las tiendas y todo. Y hago ya más actividades que antes.
The way that she's been empowering herself, she's been growing a lot. And little by little, she's been able to advocate for herself.
Para mí es importante ella porque ella me ve como ser humano. Ella es importante para mí porque mi compañía me ayuda con la cita, los papeles, me ayuda con medicinas y a veces convivimos un poquito así y así. Es muy importante para mí ella.
Because the community health worker is not clinical, they are very much community focused. They can tap into a lot of those resources that we just don't have access to. We give them a plan here, and then she is able to see in the home setting what their barriers are.
Healthcare for decades has been trying to solve community issues from a healthcare perspective, but we'll never be able to really accomplish that unless we are engaging that community as partners in the process. Alejandra has been just a wonderful example of what a true community health worker does and is. But it starts with the heart. They have to have a heart for service.
That's what I hear. That is, I wanted to be with them in the same boat. No outside, with them, inside, in the same boat with them. Is the best way that you can see the missing parts of the puzzle. So this kind of work that we're doing, we're gonna be able to touch more in depth on the patient, not just as a patient, but as a human.
All right, I know I've thrown a lot of information your way and went a little bit over time and I apologize for that. Are there any questions?
Hi, Tiffany, I do have a question. Is it okay to ask you?
Yes, please.
And so according to, so you know, the roles and responsibilities, so you talk about community health workers. I see some overlaps with like the case manager and also like the, you know, the health educators. So how we distinguish, so, you know, those professions, so.
A lot of times community health workers really work hand in hand with the case manager or health educator, and it really just depends on the organization to kind of define those roles. Community health workers can provide some health education if they're trained in it and it does not require licensure. So it depends on the organization. Those are all things that the roles and responsibilities I listed were all things that they can do. But not necessarily things that, like, if an organization already has someone doing one aspect of the job, then they just coordinate and make sure that their clients are receiving those services.
Thank you very much, Tiffany.
Yeah. I'm gonna stop sharing so I can see. Chat. Any other questions or information that I could provide to anyone? All right, well, thank you so much for your time and letting me share. If you ever have any questions, I'll just real quick share my screen one more time so that you can see my contact information. I'm available to help anytime that you need it. Thank you.
Thanks so much, Tiffany.